It hurts. My children asking me where's her sister. It hurts. It's been 3 years, but to me it's like if it was just yesterday.
Activists and parents gathered outside the Disneyland Hotel late last week to share how alleged medical malpractice contributed to their children's deaths and why they believe it's time for an overhaul of patient safety laws in California.
After he was administered the poisonous combination of medications, Alex was left unmonitored in bed for hours, and when he was finally checked on, he was found dead, already in rigor mortis.
Unfortunately, he had the disease of addiction, and rather than the doctor trying to help him overcome that addiction, the doctor provided him the loaded gun.
They're putting forward a ballot initiative that would require doctors to take random drug and alcohol tests on the job, among other changes.
In this country, we have a crisis. It's an epidemic. We lose one life every 19 minutes to a prescription drug overdose. So the doctors are the gatekeepers to how these drugs get to the street, and we need to start monitoring what they're doing and how they're doing it.
I don't see why in the world it wouldn't be appropriate for them to be drug tested, especially in the fact that they are prescribing medications to our young people, and many of our young people are dying. For goodness sakes, even car salesmen are drug tested.
If the measure passes, doctors would be required to take random drug tests, report colleagues who they know are under the influence while on duty, and check a patient's prescription history before prescribing them narcotics. It would also increase the state's $250,000 limit for non-economic losses in medical negligence lawsuits. That cap, which was set in 1975, would be increased by the amount of inflation that's taken place since then. And activists have a musical to help make their case.
I don't have to pee in a cup.
But you operated on my kid last week.
The measure, meanwhile, is opposed by the California Medical Association, which was holding a statewide conference inside the hotel. The association's president, Dr. Paul Finney, says this is all just a distraction in order to boost payouts for attorneys.
What this activity is about is changing a law that works very well to protect patients. And if were it to pass, were this initiative to pass, community clinics would have to close. Patients would have more trouble finding a doctor, and trial lawyers would have more money pulled out of the healthcare system right into their pockets.
Activists say their effort truly is about patient safety, and that the measure stems from the experience of Bob Pack, whose 2 young children were killed by a prescription drug-addicted driver.
He found out that the driver had been overprescribed thousands of narcotic pills from 6 doctors at the same Kaiser facility. So no one was checking if this patient needed those medications, what her prescribing history was. No one was checking to see if she really needed all the pills that they had prescribed her. This is definitely about updating California's patient safety laws that haven't changed in 38 years to the modern day.
The stage is now set for both sides to battle over whether the measure would help or harm patients.
For God's sake, my son was poisoned to death in a hospital. We are fighting to stop this madness. Why doesn't the CMA join us in the protection of public health?
My heart goes out to families like that have something happen that is tragic. But that's not what this initiative is about. Were the initiative to pass, patients would have more trouble finding a doctor, community clinics would have to close, and more money would come right out of the healthcare system into the pockets of trial lawyers.
We're not going to go away. We're a grassroots organization. We lost our children. They're dead. But we want to avoid having other children and other families lose their children.
It's really too bad that the proponents have chosen this setting today to bring such an unhappy message to the happiest place on earth.
In memory of our beloved son, we fight for change in hopes that no other parents suffer the unbearable loss of a child due to negligent doctors.